Mr. President, I've represented a congressional district in the state of Illinois for 14 years, and now this is my 21st year in the Senate. It is a big state, 102 counties, and we are proud of our diversity in our state, which runs from the great city of Chicago to deep, deep southern Illinois, to a town of Cairo, which others might call Cairo, but we call Cairo, Illinois, which is literally south of Richmond, Virginia, by latitude. They grow cotton down in that end of the state. So it's a very big and diverse state. I'm proud to represent it, and I've spent some time doing my best to understand the challenges that businesses, individuals, and families face, and to measure their sentiments on issues over the years. So for the last several months, I have spent my time visiting every corner of downstate Illinois, which is the more rural, small-town area of our state outside of Chicago. More conservative politically, President Trump ran well in some parts of downstate Illinois, and I've been in this area, representing it, growing up in it, to measure what I consider to be the topic and issue of the day, and that's the issue of health care in America. It's an issue which each of us takes very seriously and personally, because each of us is called on in a variety of different ways in our lives to have health care for ourselves and our family, the people we love, at critical moments. We're now engaged in a national debate about the future of health care in America. The Republicans control the House and the Senate and the White House, and have been, from the beginning, opposed to the Affordable Care Act, which was passed under President Obama. I voted for it. I think it was the right vote. I think it's achieved a great many things, and I hope that we can build on it to make an even better health care system for our nation. It is not perfect. There are areas that need to be changed, improved, and areas that I think need to be strengthened over the long haul to make sure that America has more fairness when it comes to health care for our people. Last week, I visited about a half dozen healthcare facilities in Illinois. I jokingly say to my staff, I've come to know hospital administrators in my state far better today than I ever have. Here's what they told me. They told me that the health care bill that Senator McConnell has proposed in the United States Senate would be devastating to the families, the patients, the employees, and the healthcare facilities in our state. They told me that nearly $800 billion in Medicaid cuts would cripple rural hospitals and health clinics. Not only would this harm patients in rural communities, but 35% cuts in the Medicaid program would also cost jobs in Illinois. The Illinois Hospital Association in my state estimates that the Republican bill, which passed the House and now is being considered in the Senate, would cost us 60,000 healthcare jobs. I went to Granite City, Illinois, which is near the St. Louis area. I met a young woman named Sam who has Down syndrome, and her mother, Missy. They are worried about the Republican plan to cap Medicaid spending. Sam's health needs can't always be anticipated. There's not some that can be capped in terms of future needs, and the amount of care can hardly be determined in advance for this young woman who's doing her best to lead an active, involved life facing the disability which she does. This is so true for so many people nationwide. Some of my Republican colleagues in Illinois have said, we just don't understand why Medicaid as a program has grown so much. Well, it may be hard to understand until you look inside the program and realize what it does. Medicaid may have started as a small idea, but it has really grown into a major provider of health care in America. In my state of Illinois, it is responsible for paying for the prenatal care, birth, and the care of children and their mothers after they've been born for more than 50% of the kids. It is an important provider of healthcare resources to our school districts in Illinois, which count on Medicaid to help them take care of special needs students, counselors, psychologists, transportation, even feeding tubes for those who are severely disabled. It is a critical program as well for the disabled community, like Sam. Young men and women, victims of autism or Down syndrome, who want to lead a full life but need health insurance. Medicaid is their health insurance. One woman said to me in Champaign, Illinois, my 23-year-old son is autistic. He counts on Medicaid, and Senator, if I don't have Medicaid, my only recourse is an institutional program that would cost us over $300,000 a year. It's impossible for us to even consider that. So those who would cut back on Medicaid spending in the name of flexibility or saving money or generating enough to pay for a tax cut for wealthy people would leave people just like those I've described in a terrible circumstance. But I haven't even described the largest cost in Medicaid. The largest cost in Illinois and across our nation is the Medicaid services and benefits provided to those who are older, mothers and grandmothers in nursing facilities and care facilities that count on Medicaid along with Medicare and Social Security for the basics in life. I heard from Kevin. He's a worker from Urbana, Illinois, who is worried that the Senate Republican bill is going to increase his out-of-pocket expenses by thousands of dollars. He's worried because he fits into an age category which would see premiums go up dramatically in cost under the Republican bill. The Affordable Care Act, which was passed under President Obama, set limits on the increases in premium cost so that no premium paid would be more than 3 times the cost of the lowest premium that is paid for health insurance in our country. Well, the Republicans have changed that. In both the House and Senate, they've raised that to 5 times. So it means for people, particularly between the ages of 50 and 64, they're going to see a substantial increase in their premiums because of that Republican provision. People are following this closely enough to know that when premium costs go up, for many of them, it becomes impossible to buy the coverage they need. As I return to Washington, I once again face the reality of what this Republican health care plan would mean. The nonpartisan Congressional Budget Office told us that the bill would cost 22 million Americans health insurance coverage, cutbacks in Medicaid as well as cutbacks in private insurance. Think of that. I don't know how the Republicans in our state can go home and explain why 1 million people in Illinois are about to lose their health insurance in the name of health care reform. I can tell you that the notion of repealing the Affordable Care Act may have had some surface political appeal until you realize you might be one of the 1 million people in my state who ends up with no health insurance when it's all over. It would cut Medicaid dramatically, as I've mentioned, and then keep cutting, a 35% cut over the next 20 years, with devastating impacts on hospitals and clinics and many other facilities. By 2020, average premiums in the individual market would increase by 76% under the Republican plan. Costs would skyrocket even higher for seniors, rural communities, and those with medical needs. What happens to people with pre-existing conditions under the Republican repeal bill? 1 out of 3 Americans has a pre-existing condition. In the old days, they couldn't buy insurance, or if they couldn't afford it because they had a history of cancer in their family, diabetes, heart disease. Well, this Republican plan would take away the protections of the Affordable Care Act. It would allow states to waive essential health benefits like maternity care, mental health treatment, substance abuse treatment. People in need of these services would be left to fend for themselves. The Congressional Budget Office analyzed the Republican bill, and it said, and I quote, "People who use services no longer included in the essential health benefits would experience substantial increases in out-of-pocket spending on health care or would choose to forego services. Moreover, the Affordable Care Act's ban on annual and lifetime limits would no longer protect people." So with this scathing analysis by the Congressional Budget Office, what did the Republican leadership decide to do? Instead of addressing these challenges straight on, they retreated. They shut themselves off behind closed doors and tried to cut a deal within the 52 Republican Senate members here to pass this measure, as bad as it is. Not one hearing on this bill, on the Republican health care bill, no markups, no amendments, and no support from medical advocates in any part of our nation. No input in the Senate from any member outside the Republican caucus. They want to call this bill right away, and it's understandable. The longer it sits out there and the longer they get to know it, the less they support it. And you know, we still haven't seen the final language. Why? Because Republicans continue to work in secret on a bill that literally impacts 1/6 of the American economy and every single person in our country. This measure affects everybody. Even if you get your insurance through your employer or Medicare, this bill would make Medicare go insolvent sooner and allow employers to once again impose annual or lifetime limits on care under their health insurance plans. Now, the latest we've heard is that the Republicans are meeting in secret, making some changes to this bill. They may be throwing some money at the opioid crisis facing America, but that won't make up for kicking 15 million people off of Medicaid. The amount of money they're talking about to deal with the opioid crisis is literally inadequate to deal with the seriousness of that issue or to provide the substance abuse treatment people currently receive from Medicaid who will be cut off under the Republican plan. Cutting Medicaid, our best tool to fight opioid epidemic, and offering a coupon for drug treatment is a cruel step backwards. And if it ends up buying a vote on the Republican side, shame on my colleagues for selling out so cheaply. Republican Governor John Kasich of Ohio is not fooled. He called this idea of a special opioid fund to win some votes on the Republican side, quote, like spitting in the ocean. I called Governor Kasich this last week. He and I came to Washington together many years ago, and I've known him, and I like him. We disagree on some political issues, but he's very forthright and frank, and he has warned us that what's going to happen to Ohio is going to happen to the nation if the Republicans have their way with their health care bill. We've also heard the Republicans are considering adding provisions that allow insurers to offer bare-bones plans. I've just heard some more about this today, and I believe that the author of this idea is the junior senator from Texas, Senator Cruz. Here's what he says. If your state offers an health insurance plan that complies with the requirements of the Affordable Care Act, then you may offer to other consumers in the state insurance plans that do not. He says it gives consumers choice. Well, it sure does, but look at the choice it gives them. Because if he is aiming for lowering premium cost by offering health insurance plans that are junk plans, health insurance plans that are fake insurance, the net result is going to be people paying a lot more in copays and deductibles, a lot less coverage when they definitely need it. A couple other things it will do. Because these younger, healthier people will buy the cheaper plans, believing they're invincible, it will end up raising the cost of premiums for those who buy other insurance. The discrimination in terms of premium cost will be dramatic, and that in and of itself could be damaging to people all across the United States. So Senator Cruz believes that offering junk insurance plans and telling the consumers, we're giving you a choice, is going to answer the needs across America. It won't. It'll raise premiums on everyone else. It will provide inadequate coverage for those who buy these plans. And sadly, many of them are going to be facing deductibles and copays that they just can't handle. That's no answer. It may be a political answer to get his vote, but it's certainly not a credible answer. We had this before, the Affordable Care Act. Do you remember what it was like? People got sick and found out their insurance didn't cover what they needed. Women were pregnant and found out their plans didn't cover maternity or newborn care. People were diagnosed with a mental health condition and found out their insurance covered no treatment for mental illness. So what good is insurance if it doesn't care for the most basic and essential needs of Americans? Thanks to the Affordable Care Act, we changed it. We required that policies provide real insurance for real families. You know what happened in addition to providing more care for people across America? The number of bankruptcies, personal bankruptcies, have been cut in half since the Affordable Care Act passed. Why? The number one driver of personal bankruptcy and family bankruptcy in America was medical bills. Medical bills that were beyond the payment of an ordinary person. There are fewer of those today because of the Affordable Care Act. The Cruz plan, Senator Cruz's plan for selling fake insurance or junk insurance plans that won't be there when you need them, I can just tell you, it means more business for the bankruptcy court. And it would banish those in a pre-existing condition to a world of sky-high premiums, all in the name of Senator Cruz's freedom of choice. Well, freedom isn't free when it comes to relegating so many Americans to such a precarious state when it comes to health insurance. No matter how much the Republican senators tinker around the edges, they're dealing with a flawed, inflexible bill. The American people oppose any bill that rips health insurance away from millions of individuals and families. They oppose any bill that causes nearly 1 million people nationwide to lose their jobs. And they also are opposed to a Republican health insurance plan that would cost coverage for 500,000 American veterans. The American people oppose any bill that hurts those with pre-existing conditions. They oppose a bill that throws millions of people off Medicaid and slashes billions in federal funding to hospitals, health clinics, and schools. The American people oppose any bill that is rejected by every major medical and patient group. The Republican bill is opposed by the American Hospital Association, the American Medical Association, nurses, pediatricians, AARP, heart, diabetes, and lung associations. How can you write a bill that draws that much opposition? They did it. They did it behind closed doors, and they don't want you to see what they're doing with it now. Finally, the American people oppose any bill that takes away nearly $1 trillion in health care in order to provide hundreds of billions of dollars in tax breaks to the wealthiest Americans and large corporations. Case in point, of the 145 pages of the Senate repeal bill, 94 of the 145 are devoted to slashing Medicaid and providing tax breaks to the wealthiest Americans and pharmaceutical companies. One conservative writer penned an article last week, which I read, which said, this gives conservatism a bad name. When we are giving tax breaks to the wealthiest people in order to cut and eliminate health insurance for the poorest people in America, and that's exactly what this bill does. I'm glad Senate Republicans delayed their vote on this repeal, but many of them have not given up. In all of my town halls and discussions, the plea from Illinois people has been clear. Improve the Affordable Care Act, don't repeal it. So where do we go from here? First, Republicans need to take repeal of the Affordable Care Act off the table. We need 3 Republicans, only 3 out of 52, to stand up and say, this is the wrong way to go about it. Second, President Trump must stop undermining the stability of the insurance exchanges and marketplaces with uncertainty and sabotage. Third, we need to work together on a bipartisan basis to strengthen our current system. We need to address the price of pharmaceutical drugs. The current bill and law does not. That is the biggest driver, according to the Blue Cross in Illinois, of premium increases, the cost of pharmaceutical drugs. And we need to build competition through a Medicare-like public option available to everyone who chooses it across the United States. Now, so many Republicans, including Senator McConnell, have said, well, the Republicans have to do this by themselves because the Democrats just refuse to work with them. That's simply not true. We're here. We've been here all along. And we want to have a hearing, bring in some experts. Let's just have a meeting. That would be a breakthrough. Democrats have asked the Republicans to join us. Let's sit down together informally, like grown-ups, and address this issue in a responsible fashion. We're ready and willing to work together on legislation that improves the individual market for the 6% of people who purchase their insurance there. I fail to see how gutting Medicaid and throwing 22 million Americans off health insurance in order to provide tax breaks for rich people does anything to help those 6%. So, Mr. President, this is a critical moment when it comes to health care across America. It's unfortunate we're now considering a bill that was only revealed 2 weeks ago, a bill that has never been subject to a hearing before any committee, a bill that has never been amended. When it came to, at least in any open process, when it came to the Affordable Care Act, over 140 Republican amendments were adopted. The Republicans haven't offered us the opportunity to offer one amendment to their proposal, not one. It's a take it or leave it, closed door deal. That is not the way the Senate was designed to work. It's not the way the American people want us to work. They expect us to work in a constructive fashion on a bipartisan basis to solve the problems facing our nation. And the biggest single problem is giving peace of mind to Americans and American families across the nation that they have health care that they can count on and they can afford. Mr. President, I yield the floor.